I've mentioned that the medical community is at least 1/3 to blame for the opioid crisis because we overprescribed and perhaps we didn't know enough about addiction, and that's probably very true. But again, we didn't do much about giving patients resources for once they are caught up with the addiction process. And I've often talked to some of my colleagues about, even in the emergency room, is this where addiction begins? It maybe does. It certainly has something to do with it, but we certainly didn't do anything to stop it. So if we've ever uttered the words, a patient that's come to the ER multiple times for the same pain issue, and of course pain is one of those things that it's subjective. We can't prove it. We just have to go by what they say. And if they say it's 10 out of 10 pain, we just have to assume that. But I'm guilty, much like many of my colleagues in emergency medicine, where I've probably uttered the words, how many Norcos will it take for this patient to leave bed 6 so I can open up for the chest pain in the waiting room? And I'm just as guilty until I did more research about the disease and educated myself. And now I find myself educating others.